Good morning. I'm John Woodrich, CEO of Bryan Medical Center. Welcome to our briefing on August 27th. We have a couple guests with us today, Katie Packard, a clinical pharmacist, and Dr. Aina Silenieks, a pathologist, and I think you'll be very interested in their information today. Wanted to give you an update on testing. We've tested 20,524 people, 2,299 positives. Our midnight census is 497. We have 13 positive COVID patients in-house. 2 of those individuals are on vents. 6 are from Lancaster County, 7 from outside of our county. 2 are in our intensive care unit, 4 in our progressive care unit, and 7 in our general care unit. And I'd like to now introduce to you a clinical pharmacist, Katie Packard. She has spoken with you before. She will give you an update on the convalescent plasma. She is a clinical pharmacist here and has been very engaged in this, has a great background. She is a professor at Creighton University with a practice here at Bryan Medical Center. She is an adjunct professor of pharmacology at Union College, PA program, and at the University of Nebraska Medical Center College of Dentistry. She's a research pharmacist for us and serves as one of the study coordinators for convalescent plasma program. So I'm going to ask Katie to come forward.
So as mentioned in previous press briefings, there are no vaccines and no specific drugs that have full FDA approval for the treatment of COVID-19 at this time. That said, there are over 3,000 registered clinical trials assessing therapy for either the treatment or prevention of COVID-19. At Bryan Health, a team of individuals has been working to provide patients access to leading-edge treatments for COVID-19 infection. In addition to our standard treatment with supportive therapy and steroids when appropriate, patients at Bryan Health also have access to the antiviral drug remdesivir through an FDA emergency use authorization and also convalescent plasma. Convalescent plasma is a blood product donated from individuals that have recovered from the COVID-19 infection, and it contains antibodies to the virus. At Bryan Health, this treatment has been available through an expanded access research study in collaboration with the Mayo Clinic under 2 principal investigators here, Dr. James Nora and Dr. Daniel Smith. Dr. Aina Silenieks, whom you will be hearing from shortly, presented an informative summary about this therapy back in late April. To qualify for this study, patients must have been hospitalized with either severe or life-threatening COVID-19 infection. Today, we would like to update the community on some of the preliminary results from the Mayo Clinic that they have released. At Bryan Health, our first patient was enrolled on April 18th, and to date, 127 individuals have received convalescent plasma at Bryan Health. More than 73,000 individuals have received convalescent plasma throughout the United States under this Mayo Clinic trial, and that's been done at more than 2,000 sites. And the yellow dots that you see there on the U.S. map indicate locations where the study was conducted. First, the Mayo Clinic published 2 safety analyses. The first was in the first 5,000 patients that received convalescent plasma, and then they did it again with the first 20,000 patients that received convalescent plasma. Serious adverse events related to the transfusion of plasma were less than 1% in both analyses. And while no therapy is ever considered perfectly safe, the data here suggests that relative to other therapy risks, convalescent plasma is safe. More recently, the Mayo Clinic released efficacy data, preliminary efficacy data, in approximately 35,000 patients that have received the plasma. The second chart here, or the first the second slide, there are two charts. It shows that for patients that received the plasma early, within 3 days of their COVID diagnosis, they had a 7-day death rate or mortality rate of 8.7%, which was significantly lower than the 7-day mortality rate for patients that got the plasma later, 4 or more days after their diagnosis of COVID. The researchers also report that for infusions that contained higher amounts of antibodies, the patients had improved 7-day survival. Patients with lower antibody levels had an 13.7% mortality compared to those infusions that had higher levels of antibodies, which had 8.9% mortality. And while we're not permitted to release specific results from the patients that receive convalescent plasma here at Bryan, we can say that our survival data and our safety data compares favorably to what we just showed with the Mayo Clinic. It should be noticed that these trials were not randomized or controlled, and that is normally the gold standard for achieving full FDA approval of a drug. Other institutions throughout the United States are currently conducting randomized controlled trials of convalescent plasma. However, in this large Mayo Clinic study, there was no placebo or no control group. And what that means is that all patients who choose to be in the study did receive convalescent plasma. Therefore, it's difficult to know from this one study alone, even though it's very large, with full certainty how effective treatment is. On August 23rd, the FDA granted emergency use authorization for convalescent plasma based on this Mayo Clinic data and also nearly a dozen other smaller trials. And while the FDA will continue to evaluate data from other randomized controlled trials, this emergency use authorization will remove some of the barriers for institutions to treat COVID patients with convalescent plasma, and it will expand access throughout the United States. Bryan Health will continue to offer hospitalized patients access to convalescent plasma, but now it will be under the emergency use authorization. Dr. Silenieks will now speak about the importance and the logistics of donating convalescent plasma in light of this authorization.
All right, good morning. I'm Dr. Aina Silenieks. I'm a pathologist and the medical director of the Transfusion Service here at Bryan Medical Center. And I'm here today to provide you updated information on how the Transfusion Service has provided convalescent plasma to COVID patients who have been treated here at Bryan. As I mentioned in my previous presentation, you may remember this slide, Bryan Medical Center obtains all its blood products from Nebraska Community Blood Bank. NCBB is part of a group of affiliated blood banks in various parts of the country, as you can see from this slide. We've got New York Blood Center on there. We've got Delmarva Blood Bank, which is in Delaware, a couple of other places in Minneapolis and Kansas City. But the good thing is, this made it possible for us to get COVID convalescent plasma for Bryan patients beginning basically as soon as we signed up to participate in this study. Initially, most of the plasma that we received was from the New York Blood Center or the blood bank of Delmarva in Delaware, as the number of COVID cases on the East Coast was far higher than we had seen in Nebraska yet. So I wanted to show you kind of where our products have been coming from. Nebraska Community Blood Bank began collecting convalescent plasma at the end of May. This is a summary of sources of our COVID convalescent plasma that has been used for patients here at Bryan. And you can see that the majority of the 150 products that have been transfused did come from New York or Delaware. Now that NCBB is collecting, we're getting more products locally. We've gotten a few from Minneapolis, and the American Red Cross was a patient who was transferred in and brought the product with them. The good thing to know is that our transfusion service maintains an inventory of convalescent plasma on site at both East and West Campus. Currently, most of the units that are common blood types like type O or type A are from Nebraska Community Blood Bank. When we need plasma from patients with less common blood types like B or AB, often we have to tap into our resources in New York or one of our other partners. But despite that, we have been able to provide the convalescent plasma to patients quickly, often within just a few hours after the decision to transfuse the plasma has been made. However, there is some additional information that I would like you to think about. As you know, the Lincoln-Lancaster County Health Department has a COVID website. If you go to that website as of August 25th, which was Tuesday, the total number of lab-confirmed COVID cases in our area is just over 3,700. The website also says that 1,739 individuals have recovered from COVID, which is great. However, to date, 30 recovered patients have donated convalescent plasma at Nebraska Community Blood Bank. So I'm here today to let you know that NCBB is actively recruiting patients who have recovered from COVID and asking them to donate their plasma. This is a flyer which summarizes the basic information on who is eligible to donate plasma. First of all, you have to have a lab-confirmed positive test for COVID-19. You have to have been symptom-free for a minimum of 14 days. And then obviously you have to be willing to donate your plasma. And in fact, a single individual can donate up to 4 separate times. All a potential donor needs to do is go to the NCBB website and follow the instructions there. Each donor gets a specific scheduled appointment time. This ensures that all distancing guidelines are followed as they should be. It only takes about an hour to donate, and the process is simple, it's streamlined, it's professional, and it's safe. And you get a cookie afterwards, which is always a nice added benefit. So over the last few months, as you heard from Dr. Packard, we have learned that COVID convalescent plasma may be of benefit in the treatment of hospitalized COVID-19 patients. And above all, I'm pleased to say, particularly since I'm a blood banker, it's safe. So I'm asking those of you out in our community who have recovered from COVID or know someone who has recovered, please consider donating plasma. Recovered patients are a very special group of individuals. They have an invaluable but scarce resource that may benefit others. Therefore, I would like to close by saying, please be the type that gives. Thank you.